Hello and welcome everybody. I'm very pleased to introduce Jason. Jason, do you know, I'm going to have to, me and names, as we know, every week is a horrendous thing. And I want to say, is it Jason because I haven't got it in front of me, which is ridiculous. Jason Higginbotham, but is it Botham?
Yep, Higginbotham. That's an easy way of, that's how most people say it.
It's a great one. Where does it originate from? Is it from a particular area or?
From the north of England, primarily Lancashire and Yorkshire. I believe it's a Viking name. I believe. I'm not sure of the actual meaning.
Anyway, thank you very much for joining us on this very, very hot day. And today we're going to talk about myopia. So everyone's heard of myopia, but it would be interesting if you drill down to people as to, okay, what is myopia? They might just say, oh, it's something to do with the eyes. But Jason's going to tell us about it, and particularly why it is important. And, you know, what we spoke about earlier is really frightening as to why we should all know about it sooner rather than later. So Jason, before we get into the nitty gritty about myopia, perhaps you could just tell us a little bit about you and your background.
Okay, well, thank you very much. Well, as you've already heard, my name's Jason Higginbotham. I am an optometrist and dispensing optician, been in the business, as it were, for 32 plus years now, actually, this month, which is terrifying. Worked in all kinds of areas of optics. I won't go into that. But what I tend to do now, having worked with manufacturers and suppliers for nearly a decade, and a little bit with academia as well, I consult for quite a few companies, and I've set up a website called myopiafocus.org, which aims to hopefully educate the public, parents and their children about myopia. So that's one of my main key areas. I also work with a lot of companies who hope to produce devices which may make the management of myopia more affordable for clinicians and hopefully therefore also for parents and their children. So do you want me to describe myopia, or?
Well, I was going to say, let's give a description of what myopia is so that we're under no illusions with our own. I'm also talking about myself here, my own definition, which will not be as good as yours for sure.
Well, the classic definition that probably most people will use is the term short-sightedness or nearsightedness, which just basically means that without glasses on, somebody who is short-sighted will find a point in front of their eyes, roughly, say, between arm's length and their eyes, that is naturally in focus, hence short sight, but the distance will be very blurred. And that's what we might say the refractive side of it. In other words, describing the glasses or contact lenses that a person needs to actually correct myopia. But it's a lot more than that. The most common cause of myopia is what we call axial myopia, where the eyeball gets longer or stretches so that the focusing of the eye brings things into focus in front of the retina. But the real problem with axial myopia is that stretching of the eye actually causes damage over a long period of time that can lead to a whole range of sight-threatening conditions later in life, such as cataract, glaucoma, myopic macular degeneration, retinal detachment, and many, many others. Now, some of those conditions occur due to age, but in myopia, they occur earlier. And in high myopia, they tend to occur quite a lot earlier than they would otherwise happen, and often to quite a serious extent, harder to actually treat and deal with. So myopia has been shown to increase quite a lot over the last, say, 50 years due to changes in lifestyle. And that's the worry. It's becoming more and more prevalent, and the effects of that more prevalent myopia are starting now to take shape and take effect on people's eyesight, not just in terms of the glasses they need, but the damage to the eye is starting to happen in a lot of patients, and the outlook does not look particularly good. It was quite bleak in that regard.
Oh gosh. So just to rewind, so we all know about as we get older, the muscles start deteriorating. That's probably not the right way to explain it, but you know, your sight becomes worse, and you know, from 45 or whatever, I started wearing glasses, which was a real shock to me, because you think, oh, my eyesight's perfect, and suddenly it sort of disappears. What? And I believe sort of late 40s onwards is quite a common age to start wearing glasses, but is it much earlier if it is myopia?
They're totally different things, actually. What you're describing is a very common problem. It's known as presbyopia. It means
Right.
old sight, basically, and that's why I wear varifocals. I don't really need glasses for distance, but I hate taking them on and off, so I wear progressives so I can keep them on for reading for convenience. But myopia starts quite early in childhood. The eye, everybody's born, essentially, pretty much everybody's born what we call long-sighted or hyperopic, but I won't go into that in much detail. But the eye changes its shape and curvature as people age from between, say, 1 to about 5, so that normally vision becomes very clear, and it's called emmetropization. It's not an easy one to say. However, lifestyle and things like that are affecting that process, and more people, the change of the eye continues, and myopization starts to occur. People, their eye becomes longer from about the age of 6 up till certainly, we now believe, the mid-20s. And there will be people in their mid-20s who will have very, very high myopic prescriptions. And that not only means that they need thick spectacle lenses and often more complex contact lenses, it also means that in their 50s and 60s, or maybe even earlier, they will start to suffer potentially blinding eye conditions caused by that stretched eyeball, by that axial myopia. So it occurs in early age, and it can begin to develop very early. Those people with myopia will still develop presbyopia in their 40s. And that's why you will see some people, maybe in a supermarket, for example, lifting up their myopic distance glasses to be able to read something on a label here. They're short-sighted.
Yeah.
And if they're very short-sighted, they can actually see very clearly here. And of course, it's also magnified. And they may lift off their distance glasses to be able to see because of their presbyopia, their inability to focus on near objects. But that is an aside. It's unrelated to myopia.
Right. So just to be clear, so obviously we know people who are short-sighted. If you're short-sighted, does that mean you've got myopia, or is
yes, it does. They are the same thing.
They're the same thing. Okay.
Yeah. I mean, it's a little more complex than that in the sense that most people have what we call astigmatism, etc. But we won't go into that. It just means that they have two powers at 90 degrees to one another. That's all. It's nothing too complex. But ultimately, myopia is short-sightedness. But the key thing is that it's a lot more than just a prescription for spectacles.
Right.
And the World Council of Optometry only fairly recently ratified a statement that basically suggests that myopia should really be treated not as a refractive error, but as an eye condition, as something that requires screening and eventually, obviously as well, if it exists, therapy. And not just therapy for the damaging conditions that occur much later in life, but there are ways to slow the progression of myopia. And if you do catch children young enough, theoretically at least, with the right alterations to lifestyle at least, you might be able to slow the onset of myopia, or even prevent, in some cases, potentially the onset of myopia. There are a lot of potential causes, and certainly in some parts of the world, there is also a genetic predisposition to myopia, which means it's more likely in some children from some parts of the world. But it does all really depend on lifestyle. And in the UK, in the last 50 years, the levels or amount of myopia have doubled just that time. And
so it's something that starts, or it's the point at which, from your sort of from 1 to 6, that's the point, presumably, that then, because you said that's when it's all sort of everything is growing, that's when you can do the real damage, is it?
No, I wouldn't say that, but you can certainly lead to things developing at a faster rate.
Right.
Myopia, as we see it in practice, develops around about 5 to 6 years of age, in the sense that's when it starts. In terms of the progressive myopia, it can happen in the teens, for example, but the predisposition to it can begin earlier in life. And the sooner it starts, the more likely it is to advance to a higher level, etc. So if it starts, say, in the late teens, and you actually do something about it, it probably won't advance to such a high level. Whereas if it starts at, say, 5 years of age, and progresses at a reasonable rate, it's going to lead to quite a high prescription and what we call high myopia. Now, I don't know if you've ever seen contact lenses where they've got numbers on, but it goes to a level that's considered over, by most sources, either -5 or -6. So anything above that level is considered high myopia. And the risks of those other conditions that I mentioned, like retinal detachment and myopic macular degeneration, go up really very, very substantially. About 140 times more likely to have myopic macular degeneration if you're a -8, for example, than if you're a not myopic. So really, really significant. But even the -1s have 3 or 4 times the likelihood of developing glaucoma and cataracts and things like that. So, and that one of the main or the major causes, apart from the genetic link, are too much close work too often and a lack of outdoor time.
Right. I was going to say, how does it happen? Well, I suppose there's a problem with age, because if it's a small child, they're not going to tell you, or they're not going to notice it themselves.
You couldn't measure it, in fact, really, as well, because the problem is that they are still essentially what we call hyperopic, long-sighted, but they're not as hyperopic or long-sighted as perhaps the average, or as much as they should be. So it means the change to 0, or what we call emetropia, is happening too quickly, but that means it's probably going to continue into the minus or the myopic powers. And that's where catching it early helps. But outdoor time has been shown to be very, very good at preventing the onset or delaying the onset of myopic progression or myopia. And I remember as a child, I spent, even as a very young, small child, the back garden of my parents' house, I was outside all the time. But they didn't have iPads, they didn't have smartphones, they didn't have consoles and computers. And TV only had 2.5 channels, and it was all very, very boring most of the time. So I couldn't watch CBeebies, and I couldn't play on a PS5, or I couldn't hold my parents' iPad and play some cool game or even do some education on it. And it wasn't until I got into, say, around about the age of 10 before I ever got homework. But everything's changed. And I was lucky enough to live in an area where I could go outside and there was lots of access to that. But for example, if you live in a city and you're a child today and you may be, say, 3 years of age, you're exposed constantly to television, including television you want to watch. You're exposed constantly to the internet. You're exposed constantly to smartphones and tablets and PCs and you name it. And all of your peers and friends have probably got the same access to that. And the amount of outdoor time you've got access to is greatly reduced because A, there aren't that many open spaces, B, it's not particularly safe. And modern lifestyles of people's parents mean that a lot of kids, until they start school, might be in nurseries and daycare, where frankly, that outdoor time is also lacking.
Is it about being outside? Is it because, is it, well, 2 things. One, because you're just looking at something that's relatively close to you, and then going outside, you go and look further afield, so you're stretching the muscles.
Well, it's not the muscles. It's
not the muscles.
Nothing to do with muscles, because that's a common misconception about eyes. Well, I say nothing to do with muscles, but basically it works in reverse. I won't go into the actual anatomy of it and the biology. It's fairly complex, but there are 2 major factors that protect against myopia. When you're outside, yes, you're absolutely right. You're doing primarily distance viewing. So your eyes are relaxed is perhaps the best way of putting it. And it also means that light isn't focusing on what we call the peripheral retina. So you've got your central retina. You're using your central retina now to see me on the screen. But your retina is much bigger than just that one area. And if light is trying to fall behind it, the eye wants to grow to reach it. And that happens when you're doing close work, lots of close work, in particular as a child. But also, there's lots of evidence to show that the light that we actually receive outdoors, the brightness and the UV levels and the violet light and other elements, the increase of vitamin D, etc., all these things also contribute to the eye not growing. There were some experiments in the 70s, which I sorry to say were on animals, and they started with a couple of scientists called Hubel and Wiesel on mice. And they were looking for something different, actually, a different experiment. But they noticed when they reduced any light to the eye of a mouse, the eye just grew in size. It became longer. because the eye was trying to find somewhere where there maybe was some light or some focus. They also added, what shall we say, a focusing strain on the eyes. And again, the eyes seemed to, they found the eyes were expanding, even unfortunately when they severed the optic nerve of the eye. So although the eye was blind and the brain wasn't involved, something in the eye itself makes the eyeball grow if light isn't focusing properly, or if there isn't any light getting in. So if you're outdoors and you're looking in the distance as a young child, the light is focusing properly and lots of light is getting in. And so when I was outdoors, and neither of my parents are myopic either, so that's not a risk. And I spent all of my time outdoors, and obviously I went to school and I did close work, but I probably didn't do as much as say my kids did at school, because they started getting homework when they were in primary school and I didn't. So everything, all this close work that they're doing and the reduced time outdoors all compounds together to be some of the major causative factors. Also elements about artificial light when going to sleep and going to sleep late and affecting sleep patterns, but also there is this genetic element. So in parts of Southeast Asia, like Korea, China, and Japan, that predisposition is also there. But those are parts of the world where all those lifestyle changes are even more prominent. So you take say a couple of kids, say in a reasonably well-off household in South Korea. Both parents are probably fairly myopic, maybe highly myopic. So both of those children are already very likely to be myopic. However, those children go to day school quite young. And then when they've finished at day school, they go to night school. That's what they do. They call it cram school. And lots of the homework they do on a computer or on a tablet or on a smartphone. And they don't spend much time outdoors. So they spend most of their early lives and teenage years on computers, on smartphones, on tablets, indoors in poorer lighting, and with the predisposition of both parents being myopic. And so there are parts of Korea where 90+% of people are now myopic. And in Japan, parts of Japan, the largest cause of current new blindness registrations is actually now because of the secondary conditions caused by myopia, like myopic macular degeneration, cataract, glaucoma, and retinal detachment. So it's already starting to cause serious sight impairment in some parts of the world. But in the last 50 years in the UK, it's doubled. Between now and 2050, it will potentially more than double again. And it's happening all over the world to greater or lesser extent, depending on things like predisposition because of the genetics, but also lifestyle. You're more likely to develop myopia in an urban setting than in a rural setting. Again, you're more likely, therefore, because of the rural setting, to spend more time outdoors. It's pretty terrible, really.
It's dreadful. And so, okay, so being the genetics, is it because the parents have developed it originally because of close work or whatever it is? And that's the genetic, is it that means it passes it on, or how does the genetic side work?
An element of it will be over many generations. There is just a predisposition to myopia in certain ethnicities in Southeast Asia. That's taken a long time to develop. But there will be, over, say, the last maybe few hundred years, an increase in myopia in those people, that some of which will now be passed on genetically as well. But for probably tens of thousands of years or thousands of years, people in Southeast Asia will have had a higher prevalence of myopia than in, say, Sweden or in Australia or places like that. It's just one of those things. But that has been compounded by the change in lifestyle. There was a very interesting study in Alaska in the 1960s where they looked at the Inuit tribes, and the elders had a prevalence of myopia of less than 1%. So basically, none of them really, because all they did was spend their time living literally on the ice, looking in the distance, fishing and subsistence living in the igloos, literally. And it sounds silly, but that's literally how they lived. But their children and grandchildren, without computers, etc., such as the 60s, were living in towns in Alaska where maybe they had access to schooling and education and television. And 25% of the grandchildren and children had myopia, from less than 1%. in a
Wow.
generation or 2 generations. And they've done a follow-up study on those groups, and it's now increased further because of the lifestyle changes, again, have had more impact.
And
So,
what's the prevalence in the UK, for example, or presumably also it does go on the demographics of people as well?
to an extent.
Or standard of living, or however you would term it.
Yes, to an extent, because it turns out, for example, and it's not because of IQ, but the higher an IQ or the higher your educational achievement or level of educational achievement, the higher the likelihood you will have myopia. But that's simply because those types of people, i.e. higher IQ or the people who've spent more time in education, are doing much, much more close work and less time outdoors. But also, if you're from a poorer background and you live in a very, very much more, shall we say, socio-economic deprived area, maybe in inner city areas and high rise, you frankly still don't have that much access to outdoor space. Where so there are lots of factors. There are a huge number of factors involved, but it is possible to do something about it. Obviously, the first thing to do with the youngest kids is make sure, if possible, they can get as much outdoor time as they can, and try not to let them have too much time on smartphones and tablets and so on, and make sure they have regular breaks. Now, there's one rule that in America they call the 20-20-20 or 20-22 rule, which is for every 20 minutes of close work, you take a 20-second break and look into the distance over that 20 seconds. And get at least 2 hours of outdoor time every day. And there are variations on that. And ultimately, though, less time on computers and smartphones and tablets, particularly for the very young, more time outdoors, particularly doing outdoor pursuits rather than reading outdoors, so distance type things. And of course, when you are doing close work, have more breaks, but also hold it further away and have more lighting indoors as well, to reduce the effort that the eyes have to make. But ultimately, there are then therapies that are available to young people developing, children and young adults developing myopia. There are a range of spectacle lenses and contact lenses and even drops now that can help to slow the progress, clinically proven, significantly slow the progress. And at the moment, the prevalence of myopia in the UK is about 33%.
Right, 33%. Okay, yeah.
But there are lots of predictive graphs from what's called the Brian Holden Vision Institute in Australia, which along with the World Health Organization, suggested in 2015 that myopia was reaching epidemic proportions in parts of the world. And the Brian Holden Vision Institute has been absolutely leading the world in the research behind this. And unfortunately, Brian Holden is no longer here, but his work was absolutely fundamental to really letting the world know about this serious condition. Absolutely fundamental work. And really, let's say you look at the prediction charts and you take a child and you do certain measurements of, say, a 6-year-old child, and you predict by, say, 20, they're going to have a prescription, say a -8, which means that they're going to have significant risks of those sight-threatening conditions many years later. But if you can do things to flatten that curve, shall we say, so that their actual prescription when they're 20 is not -8, but say -4, what you've done for them is immense. They're still myopic. You're not going to be able to stop that. You can't halt completely the condition in almost all cases, and you can't reverse it. Certainly not with modern current therapies. But slowing it down significantly will have an enormous impact, on a positive impact on the prognosis for later life. It also means that you can reduce the likelihood of them having to have really thick glasses, though, as well, when they're in the 20s and 30s. It also means that they'll be able to have maybe refractive laser surgery in their 20s without having a residual prescription, so they can get rid of glasses. But there are lots of specialist treatments. There are spectacle lenses you can wear. There are specialist soft contact lenses during the day, which will change the way light focuses on the retina, so it brings it in front of the retina rather than behind at the periphery, and that stops that impetus to growth. But there's a lens, a hard gas permeable lens you can wear in your sleep, called ortho-K or orthokeratology. And I remember doing that back in 1999 in my practice in Wilmslow, many years ago, to treat myopia for some people who didn't want to wear glasses or contact lenses during the day. But now those lenses have been enhanced so that they can also affect the focus of light to hopefully stop the progression of myopia as well. But it means as well that those children during the day don't need glasses or contact lenses.
Yeah.
That massively improves their confidence. So they're more likely to also go outdoors and play sports.
Yeah, so it's a lot of psychology involved in it, isn't it? Yeah. Totally.
And I've heard some great stories of kids who were perhaps not attaining particularly good results in sports, who've gone on after ortho-K to become really brilliant at sports. And that's fantastic. It's a real positive message. And my website, Myopia Focus, I don't want, although most of what I've been saying now is quite bleak, I don't want it to come across that way. The point is there is something that can be done. And once that intervention starts, that's a great thing. You're more than likely to reduce that child's risk considerably. And it's a great thing. The problem is that people don't know that it exists, and they don't know to take the children for screening at an early age.
Is the risk, so the risk, I mean, obviously we know about the risk because it can lead to, I mean, the worst case is blindness, but it's, if you get it early, you're cutting it down percentage-wise, maybe by 50%. Does it mean that you would still go on to have those issues, but just much later on in life? Or is it proportionately, you still carry on progressing, getting worse?
No, myopia does stop developing, usually in the mid-20s, sometimes earlier than that, sometimes earlier than that. But let's say if you did nothing at the age of 25, it stopped at -8. But if you intervened and at, say, 25, it stopped at -4. The proportional risk isn't 50% less, it's much less. So if you're a -8, you're about 140 times more likely. It doesn't mean you're guaranteed, but you're 140 times more likely to develop myopic macular degeneration. But a -4, you're more like, say, 25 times more likely to develop myopic macular degeneration. So it's not half of 140 times 70, it's actually 25 times. So in other words, far less likely to develop it.
Right,
so it significantly reduces the risk in later life. But anybody could develop those conditions, but of course, usually at a much later age.
Yeah.
So cataract, for example, normally occurs in the, say, 70s, 80s, usually, or even 90s in some patients. But it may start in the 50s and 60s in some people with myopia. But that's a condition that can be treated quite easily in most cases. But conditions like glaucoma, and in particular myopic macular degeneration, they're a lot harder to treat and manage. And the effects of those can be very, very significant. Right. And for every diopter that you reduce the prescription, that's the level of focusing power, you reduce the chances of those people developing those conditions by very, very many percent. And it's very, very much worth doing. It really is effective. And there's huge numbers of long-term studies now showing the effectiveness of these therapies and the value, obviously, to people and their sight long-term. So it's really important.
So, and so it gets, basically, it's the informative young years, which is the really important time to recognize it and develop it in your, well, not develop it, to recognize it in your child in order to then take preventative action.
Well, it would be great if every child was always outdoors, but that's likely to happen. That would be, and that's what happened if you imagine 100 years ago or 200 years ago, pretty much everybody was outside all the time doing something, whether it be playing or working. And so ultimately, that's one of the reasons why myopia is becoming more and more prevalent. So there's only so much that parents can do. It's unlikely that every 6-month-old to the age of 5 is going to be crawling around on the grass outdoors 15 hours a day. It's just not going to happen. But obviously, the more time they can spend outdoors, the better. And that's to hopefully stop or reduce the likelihood of onset. But the regular eye screening from a fairly early age will help to find those children who are at higher risk, and hopefully myopia management, as it's called, intervention could start to occur at the right time to hopefully slow that progression.
Right.
And one of the main things, because of the growth of the eye, one thing that really should be done in myopia management, the general consensus is starting to show that it would be good if everybody could measure the length of the eye, what's called the axial length. The devices to do that, although they're there, they're not commonly found in optometry practice at the moment. So measuring the prescription, measuring the curvature of the front of the eye and asking certain questions is what can be done. And it's still important that that takes place. I'm not suggesting you can't do myopia management without measuring axial length, but it would be preferred because the prescription may not always represent the length of the eye, unfortunately. Because of the steepness or flatness of the cornea at the front. I won't go into any more detail than that.
No. So is it better? I suppose I'm trying to understand as a parent, is it best to try? I don't know what age one would normally get your eyes checked, but is it something that one should be aware of and actually ask the optician about it? Absolutely.
So you've hit the nail on the head, really. Normally, in the past, certainly, children at quite a young age would have some eye screening, but generally that would occur in the first year of school, and it doesn't really occur very much in every school these days, and it doesn't really occur in preschool.
Right.
Not very well, and it's very sporadic, and it's a shame. And I have a petition linked to my website where several things I would like to see happen. One is I would love to see a national screening program at a younger age that measures the prescription of the curvature of the eye and the length of the eye in these children, but also asks all the questions. So is one parent myopic? Are both parents myopic or not? All those kinds of things. How much time does the child spend outdoors? How much time does the child spend doing close work, etc.? There's a lot of other questions, and that builds up a picture of the risk. And for those kids who are at a much higher risk, then maybe they can be screened more frequently in optometric practice. And so those kids hopefully won't, the advice can be given early enough so that the myopia either A, might not develop until a later age, and hopefully B, when it does, it won't develop as rapidly because the therapy can then begin. And so if all of those interventions took place, that would be great. Unfortunately, the NHS doesn't really provide much useful and realistic provision for children's eye care. And that's one of the other things in the petition, that there just is not enough money given to what we call primary care optometry or general ophthalmic services to cater for myopia management. The amount of money in England and Wales that's given for an eye examination is just ridiculously low. People don't realize the cost of the equipment, the cost of professionals, the cost of renting a practice, etc., etc. And it's amazing the difference between, say, dentistry and optometry. You go to a dentist and they say, we're just going to do an X-ray, and you don't even say, how much is it? They just do it, and you just pay, and it might be £50. But you in the NHS, you get, I think, still less than £30 for the whole eye examination fee. But you might be doing a whole range of tests on equipment that will have cost, all of it together, might have cost £100,000. And it's just plain wrong. And then the cost of these lenses and contact lenses is much higher than normal ones. And the vouchers that are provided are, again, just worthless in reality. They don't really cover even a tenth of the cost in some cases.
So when you go to your optician to say, I'd like my child to have a test, and I think, is it probably under 16 or 18, they can have a free eye test. Are they checking for that or not?
Well, in many cases, or most cases, perhaps not. But also, there are a lot of opticians who are no longer doing NHS eye care, just like dentists did years ago, because it's just literally, they would lose money in doing it. And so most of the, shall we say, more advanced practitioners who are doing myopia management already, or who have been doing it for some years, will very often be charging reasonable and fair amounts of money, either on top of the NHS fee or only private. So to say that a child is entitled to a free eye examination under the NHS is a little bit misleading, because that's only if the optometrist is prepared to do it for free for the amount that the NHS pays. Now, if they are contracted to the NHS, they have to, for a child, provide, but they only have to provide an eye examination. At the moment, there is no specific provision to do what we call myopia management, which is a lot more involved. It's a longer consultation, needs far many more follow-up visits, and the actual appliances that are provided, the glasses and the contact lenses, take longer to fit, require more follow-up, require more frequent refitting and more. And so it's a fairly costly thing. And the risk, big risk for me, which again is on this petition, is that there's this considerable potential that children from less well-off backgrounds are going to be at an even higher risk of sight loss in the future because they could not access myopia management when they were young. So just because of economics, and no fault of anybody's, just because of economics, they did not get access to the same services that, say, children from better off families will. And that's just plain wrong. And that's what the NHS is supposed to stop happening. And it's not doing. And in eye care, for me, eye care surely has got to be one of the most important, I'm bound to say it, I'm biased, I guess, but one of the most important things, I would imagine. 80% of everything we take in from the outside world, information-wise, and our senses really, is from vision.
Well, it is. And I think, and we started speaking earlier, the much bigger and broader concept and the worry is how it would affect the economy.
Yeah.
And, I think, as you said earlier, how, in 50 years, not much has changed in people's eyesight, but in the last 10 or 20 years, that it's changed hugely. So it's only going to get worse and worse.
Yeah.
But for the economy, it's a massive thing. So your petition, the main things is presumably is educating people to understand what myopia is, how you go and find out about it, and how you can sort out whether you do have it, you have a predisposition to it, and all those things, and then educate people how to treat it.
Yeah. And obviously, one of the other advantages from a health perspective, if you get children outdoors more often, there is not only obviously the eyesight myopia prevention or slowing element, but there's the benefits to them from a social cohesion perspective. They're more likely to engage in sports, etc. So a health perspective, and the mental health perspective, less isolation. You see so many examples of teenage boys in particular literally stagnating in a room on a console. And yes, okay, they're talking perhaps to lots of friends on a headset, but it's just not healthy, really. And get them outdoors, to get them doing more sports, to keep them active, to keep them mixing together with a greater spread and mix of people in a different environment is better for them psychologically and mentally, but obviously also, of course, from a myopia perspective. But the World Health Organization and the Brian Holden Vision Institute have predicted that by 2050, half of the world's population will have myopia, which by that stage will be 5 billion out of 10 billion people. And 1 billion of those 5 billion myopes will have high myopia. So all of them will be at a slightly increased risk of eye-related conditions later in their lives. But 1 billion people will be at very high risk. So 1/10 of the population by then will be at a very high risk of sight-threatening conditions. Now, during COVID, we also saw that because of the lockdown, less time outdoors, more time on computers, in many parts of the world, the myopia has actually been shown to increase even further, which more than anything just shows the correlation between lifestyle and myopia. It's a real correlation. But also, because of the lack of availability for treatment of older people's eye conditions, in 2019, the cost of sight impairment in the UK was, I believe, £27 billion a year. After COVID, I believe this year it's expected to be 32 billion. That's a big increase because of people who weren't getting treatment for macular degeneration and cataracts and glaucoma because of COVID, who had those conditions already. And you saw that in that short period of time, this 5 billion increase. In China, myopia and other sight-related conditions cost that country alone $220 billion a year. But in 2050, it could be 4 times that, maybe even $1 trillion a year in China. And they're trying in that country to do as much as they can to slow. It's a proper government-led campaign to slow myopia. And yes, they do have a much higher predisposition to that condition. But it's not being taken seriously enough in this country from a public health perspective, in my opinion, as well, which is another.
That's what I was just going to ask: is what does is it NHS England or whoever it is, that public health that governs these things? What is their stance on it?
I don't think they have one really. I think certainly the College of Optometrists and the College of Ophthalmologists, they recognise that it exists. They recognise that it's becoming more prevalent. They have, I guess, understandably, been cautious about the data and the evidence, but it's increasingly impossible to deny evidence, I would say. And I think most and more academics and more optical bodies and groups are saying the same thing. I'm not speaking out of turn there. I can fairly safely say that it's pretty much a consensus now that all of these bodies agree that there is progressive myopia. Moorfields Eye Hospital now has a myopia clinic. Lots of the universities now have myopia clinics, partly to help treat the condition, but also to understand more about it. And I think now that the World Council of Optometry has changed its mandate and basically produced a ratified statement that basically says myopia should be considered as an eye condition that must be screened for. So we have a duty of care as optometrists, obviously, to refer people if they seem to have things like cataract or macular degeneration or glaucoma, etc. But we are in the unique position where we can do something about myopia. We don't have to refer it to hospital for treatment. If a clinician doesn't feel confident, they could refer them to somebody who does myopia management. But it's something that we are allowed as optometrists to do, and I think are best placed to do that in certainly this country. In other countries, ophthalmologists, say, for example, in France, they do most of the refraction and side of things, and in other countries, optometrists or orthoptists and other people do it. But in the UK, optometry really leads primary eye care, as we call it. And the government, I don't think, has really responded. I don't think there's enough understanding in public health of the risks of it. If we don't fund it now, the ticking time bomb will cost so much more in the future. And I don't think any government has ever invested in healthcare to stop something happening 50 years hence, because it's not their problem in 50 years. And it's, unfortunately, to pardon the pun, a very short-sighted approach.
But if one could get together, because I can see that it is a hard task for you campaigning on myopia issues. That's a hard task. But if you look at all the other issues that you're saying, that if you treated myopia, if people went outside more, the mental health issues, there's a whole load of other conditions that would all benefit. So would it be possible to think about looking at it, getting a whole group of people together as one body to campaign? I know this isn't, we're talking about myopia and we're not talking about campaigning, but it just crossed my mind as a way to pull together more resources, more force power, to say to the NHS or whoever, this is all the benefits you'd get.
Yes, for me, definitely a multi-pronged approach. And obviously myopia is important, of course, but also obviously the conditions that it can lead to in later life. There are plenty of organisations like Glaucoma UK and the Macular Society, etc. But also outdoor time is likely to reduce the prevalence, certainly in older children and younger and middle-aged adults, of type 2 diabetes, for example. So Diabetes UK, but it has to start preschool, really, but also the education system needs to appreciate that all the selling off of playing fields and things like that, and the reduced amount of playtime and outdoor time has been detrimental. The increased amount of homework, the amount of it, and the use of computers and tablets and so on, instead of plain old writing, have all got benefits in some respects, but they've also got significant detrimental effects as well. And I think there has to be a change in how we educate children, as in at school, but also how we educate people as a whole, parents and families, about the problem that this is creating, and it is going to lead to significant problems, and sight loss is dreadful. But obviously all of the other things that could occur because of those lifestyle changes, which we're seeing, increased obesity in children, for example, all of those things, they're all adding up.
Well, obesity, the mental health issues, that, I mean, it sort of goes on and on and on, doesn't it? And the more we can do things earlier on, and that's one of the biggest issues, is taking away healthcare education from children when they're younger. Is a real problem.
And there isn't a coherent strategy, there isn't a coherent funded body that looks after children's eye care or children's health, I don't believe. I'm sure other people will counter that. But one of the problems, in inverted commas, is the fact that the autonomy of the four kingdoms of the UK is all well and good in many respects, but it would be great if they could all decide on one single, simple system that looks after, say, imagine when kids go for their vaccines at roughly 2 years of age, that a full screening of their eyes took place at that point, and they were given the correct advice, and the parents would then take those children along to an optometrist, whichever you want to call it, in, say, 6 months or a year's time. But there was a proper funding then in all of those kingdoms for those children, in terms of a proper fee for the eye examination, a proper fee for the myopia management, extra eye examinations, as it were, and proper fees or funding for the actual glasses or contact lenses. And it could be means tested, because the better off people, I'm sure they wouldn't mind. I might be speaking me out of turn again, but I certainly wouldn't mind if I had to pay something towards the eye care of my children because maybe I could afford it. Whereas those people who, for example, some people who are on low incomes do get help towards the cost of an eye examination and their spectacles. So should their children.
Yeah, but if they don't know, but it boils back down to education, doesn't it? If you don't know that's what you need to do, you wouldn't do it to start with, isn't it? So it's very tricky. I was just going to have some sort of slightly wary of time. I was just going to look through what we said, that we've obviously covered what myopia is, the global threats, and as you said, the global threat in particular that they have out in Asia through predisposition of it. And, actually when those economies start coming down because they haven't the sight, we're all affected, as we know, because as globally, we're all affected by everything nowadays. We're all so interconnected. Genetic dispositions, therapies and treatments, which we've discussed. So a lot of the therapies and treatments actually get outside. That's the quickest and easiest one, isn't it?
Yeah, I mean, there was a recent paper that said it's a very good outdoor time is very, very good at halting or shall we say, delaying the onset of myopia. But it's been shown to be less effective at slowing myopia once it's started to develop.
Okay.
But it still has a positive impact, but we mustn't forget the other elements, the physical and mental health side of things, and the fact that when you're outdoors, you're doing less close work. And so there is still a value to outdoor time, and I think we have to get that out there, that across. And it could range from everything from improved outdoor facilities in inner city areas to safer areas for more children to spend more time outdoors, etc. And it's all well and good me saying that, but I know how difficult that is. But if nobody tries to do anything about it, then it's only going to get worse.
Yeah, absolutely. And we've spoken about your partition. Just quickly, if you want to tell everyone what your website is and where the petition is and what you plan to do with the petition. Yeah,
well, the website's myopiafocus.org. It's aimed at parents and families. It's not aimed at professionals. There are some brilliant websites out there already catering for that, of course. But the petition is actually linked from the website to, it's just a change.org petition. It's gaining traction. It's not in the hundreds of thousands or anything crazy like that, which would have been lovely, but hopefully it will start to still gather more and more momentum, and hopefully it will get noticed. If anything, just to have the opportunity to speak to people in politics, health ministers, etc., to try and grab them literally by the scruff of the neck, as it were, and say, listen and wake up and do something about this, because obviously the College of Optometrists, the General Optical Council, and all these other groups, the Royal College of Ophthalmologists and so on, they know it's happening. They would love to be able to do something about it. And there are lots of manufacturers who are putting lots of money and time into obviously producing these great products and trying to get them out there at reasonably affordable prices. The government has to really act. It's down to them, and not just in this country, obviously, it's a global problem, but I'm talking about the UK, of course.
Definitely. Well, I don't know if we've got any questions. I think probably not, because you were very concise. There was a lot of statistics there, which I hope I didn't.
I'm sorry about that. I do tend to just explode with verbal, well, too much information. I'm sorry.
No, not at all. Because one of the things is we record it so people can go back, and I think that's the thing. Quite often we do go recap and write articles about these things. We'll definitely be writing an article for sure about myopia and how important it is, and actually easy things that we can do straight away to help our children, or to help when you're slightly older, is obviously we can do it. But if we don't know about it, we can't do it.
No, and all of that advice and information is on the website. That's what it aims to do, is to educate. So I hope people do go to it. Primarily people who are parents and who aren't aware of it. It would be great to get the message across.
Well, we'll certainly be pushing your website, don't worry.
Well, thank you very much indeed.
And thank you very much. And thank you everyone for joining us, and see you again soon. Thanks very much, Jason. Cheers, then. Bye.